Hi, I'm Dr. Pej Badi, a board-certified physician here at Cellaxys. At Cellaxys, we provide a wide array of regenerative treatments for orthopedic and spine conditions. We are an advocate for the science of your body's ability to heal itself through regenerative procedures and the opportunity and option to prevent or delay invasive surgeries. Spinal stenosis is an abnormal narrowing of the spinal canal or the neural foramen that results in pressure on the spinal cord or the nerve roots. Symptoms may include pain, numbness, tingling, or weakness in the legs. Symptoms are typically gradual in onset and improve with bending forward. Severe symptoms may include loss of bladder control, loss of bowel control, or sexual dysfunction. Causes may include osteoarthritis, rheumatic arthritis, spinal tumors, trauma, Paget's disease of the bone, scoliosis, spondylolisthesis, and some genetic conditions like achondroplasia. It can be classified by part of the spine affected into cervical, thoracic, and lumbar stenosis. Lumbar stenosis is the most common, followed by cervical stenosis. Diagnosis is generally based on symptoms and medical imaging. In order to properly diagnose your condition, we need recent MRIs and/or X-rays. Usually we prefer to have an MRI that is no more than 2 years old. Sometimes we require to have earlier MRIs depending on the patient's conditions. Conventionally, treatment options include medications like narcotics, over-the-counter medications, muscle relaxers, pain management and spine injections, burning of the nerve and the nerve tissue, or doing an invasive procedure, going under the knife. We used to be limited to these temporary or invasive options, but now with the advent of regenerative medicine, we have new options to explore. Regenerative treatments are defined as a process of collecting cells, regenerating abilities, cultivating them, and re-injecting them back into the precise location of injury. Whether it's a facet joint or sometimes into the disc themselves, mesenchymal stem cells are the organisms that could be extracted from the patient's adipose tissue, which is fat, or bone marrow, or from umbilical cord or placenta. Here at Cellaxys, we only use autologous stem cells, meaning that they only come from the patient's body. For spine procedures, we usually focus on bone marrow, harvest, concentrate, and re-inject it into the back of the spine using precise imaging guidance with fluoroscopy. The procedure allows patients to have reduction in pain and improve their range of motion by up to 80% in about 4 to 6 months post-procedure. Contrary to spine surgeries that have up to 3 months of severe pain and about 1 year of recovery time, regenerative spine procedures have about 1 to 2 weeks of spine soreness. Most of the patients are back at work within a few days after the treatment. If this is an option you're interested in exploring, make your appointment by clicking the button below or above this video, and we can do a full evaluation to see if you're a good candidate for stem cell therapy. Thank you, and I hope to see you at our offices soon.